Welcome to ICCG's Close-Up, sponsored by Round World Solutions, where Fortune 1000 CXOs share their enterprise strategies for competing and winning in the global economy. Our wide-ranging topics include big data, governance, supply chain analytics, enterprise mobility, and portfolio management. The goal of our interviews is to understand the CXO's area of focus, the challenges associated with that area, and their plans for confronting those challenges. The benefit to our participants is the creation of a virtual CXO knowledge pool, so CXOs can learn from each other and not have to reinvent the wheel. I'm your host, Ellis Booker. Welcome to ICCG's Close-Up, sponsored by Round World Solutions, the leader in integrated governance with project execution. I'm your host, Ellis Booker. Joining us today is David Silberstein, Service Line Director for Analytics at Leidos Health. Hello, David.
Hello, Ellis. How are you?
Joining me to ask questions today, we have Steve Winstead, a Round World Solutions partner. Hello, Steve.
Hello, Ellis. A pleasure to be here.
First off, David, can you tell us about your role at Leidos?
Sure. Well, let me give a little bit of background about Leidos Health. Leidos Health is a division of Leidos. Leidos is a $6 billion company, formerly called SAIC. Does a lot of work in national security, engineering, and healthcare. Leidos Health is the division that does healthcare, and that's about $1 billion in revenue. I'm involved in the commercial health portion of Leidos Health. Leidos Health is split up into government and commercial health. That's about $300 million in revenue. And I'm in charge of the analytics service line there. Leidos Health primary business is in implementation of electronic medical records such as Cerner and Allscripts and Epic. And then there are service lines which are things that are universal to all of those EMRs. So we have things like revenue cycle and strategy and analytics, which is what I lead. So analytics, by definition, is the use of data from operational or transactional systems to make decisions about the business. And so that's basically what I'm in charge of for healthcare.
David, before we go on with some questions, how big is the team, the analytics team there at Leidos Health?
So the folks that we have dedicated to analytic number about 10, but then there are a lot of people that are dispersed throughout the practices. So in other words, you can have folks that are know about the technical infrastructure for analytics, or are subject matter experts in specific matters of analytics, such as predictive modeling or visualization. But then there are quirks and foibles for the various EMRs. So we have people in the Cerner practice, Epic practice, et cetera. And if you count all of those, you're looking at about 40 people.
Okay, very good. So obviously there's a lot going on in healthcare right now from a legislative standpoint. Can you broadly tell us about some of the big trends and how they relate to analytics and how Leidos Health is reacting?
Sure. I mean, there's if you look at the provider side, there's three main areas that analytics fall into, excluding research, of course, which is a whole other thing. But it's financial, quality and outcomes, and operational. So financial is, of course, money's billed and collected. Quality and outcomes is how well people are doing, and many of the regulatory measures. And then operational measures are things like, overtime that people are putting in and that sort of thing. And so what the main current in healthcare, which is being driven by the government, since CMS is really the elephant in the room when it comes to the healthcare insurance, is the move from pay for volume to pay for quality. And so the major challenge that is involved with that takes a lot of forms, such as patient-centered medical home and population health. And the real challenge is linking the cost data, which is the reimbursed claims, with the EMR data, which is the primarily around the outcomes. And so that's one of the main tools that we're seeing in healthcare, as well as sort of underlying things, trying to get the kind of operational reporting that has been prevalent in many industries up until now. So, for instance, in some hospitals, they're not even real sure how many people were in the hospital the night before. They may know how many people were there a week ago, but not how many were there the night before. And you really need to know that, how many are there now, or at least the night before. So those are the two main areas: is pay for quality, and increased efficiency in the operational reporting.
The volumes of data, structured and unstructured, in the healthcare scenario, are those increasing? I mean, one senses that with all the real-time devices and so forth, that is happening. How can that be harnessed by hospitals and also by the payer side?
Sure. Yeah, the amount of data is really increasing exponentially. So there are sort of two ways to harness that. The first is the types of analytics that I mentioned previously are traditional analytics involving the use of structured data, and sometimes that's not big data. You can call it little data if you like, and that is where you kind of know what it is that you're looking for, and you need to determine how to get that out of the systems, both from a technical perspective and also from an organizational perspective.
Can you take that answer again, David? I'm sorry about the phone.
Sure. Right. So the challenges involved in harnessing the power of healthcare data revolve first around using the structured data that's extant in the operational systems to make those type of decisions around quality of care and operational efficiencies that I mentioned earlier. And that's not, while that is increasing exponentially, it's not traditionally what's referred to as big data. Big data, I guess, is one of those things. It's like standards. Everybody's got their own definition of it. And my definition of big data is unstructured or multi-structured data. And so that data is in the healthcare setting is, as you mentioned, things like device data. Can also be the text in the form of transcribed physician notes. Can also be imaging data. Can even be call center or clickstream data from websites. And the primary use of that right now is from a exploratory or a discovery type of use. So if you've got some kind of outcome, if you know what the outcome is, what are the precursor events to that outcome? So, why are people being readmitted? Why are people having complications? Why are people having falls? And then based on the data sources that we have, we can try and do some discovery around that and determine in a broad sense what's precursor events to that final outcome. And once you have those precursor events, then you could start to do you could look at it and start to do the more traditional analytics with the structured data and the very fine granularity.
I'd like to open it up now to Steve Winstead to ask a few questions. Steve?
Yes, David. One question around this structured and unstructured data you're pulling together. We always know that data quality can sometimes be an issue in this. Have you had to create sort of a data quality initiative to support the pulling together of all these various data types, both structured and unstructured?
Yeah, I mean, there's actually that kind of splits out into two issues. One around data quality. So, does the data look like the way that we think that it looks? And then that kind of morphs or evolves into data governance. Because once you get above that very granular atomic level of data, you have these kind of higher concepts. So, an example of the granular atomic data would be blood pressure or lab data or something like that. The next higher level is going to be something like what is a location, what's an orderable, how do we define length of stay, and those issues are a lot more. So once you get the clean data, then you have to get everybody to agree on what those larger concepts look like, and that's really one of the biggest challenges that we run into. It's not as much the technical stuff, although that is that does have challenges to it, but it's figuring out a mechanism that everybody can work with within the enterprise, both IT and the clinical users and other users within the business, to build these data to build the requirements for the analytics, because you can't build everything at once, and then to agree on these concepts in a timely fashion for the data definition.
And we are going to be talking to you about data governance in just a moment or two, but I wanted to make sure that we had a sense of the Leidos Health big data initiatives, as you defined, I thought, very well, big data. Are you seeing some surprising insights from those projects?
Yeah, there's a couple that we're working on in particular. One is, as I mentioned, doing text analytics on the transcribed physician notes, and that can be there's an additional challenge there, because you're not just looking for words within the text analytics, but so for instance, you want to make sure that cancer is not confused with no evidence of cancer or something like that. And sometimes there are specialized tools that are used to translate the text into those clinical concepts, vocabularies, ICD-9 or SNOMED. Those are presently, a lot of that is done through custom coding of using proximity and semantic searches. And one of the initiatives that we're working on is trying to bring machine learning to bear on that. So right now, if you've got something that you want to look for, like instance of heart attacks, you have to code that. You know that you have a problem with that, and you have to code it custom to be able to look at precursor events. Or where we'd like to get to as an end state is you would be able to look at all the data and say, oh, here's something that's happening that's not on the radar. So I don't know, we have to reset broken arms 50% more than the norm or something like that. And here's the precursor events that make that happen. That's where one of the places we're trying to go with big data.
So more of a, if you will, a data discovery through machine learning, perhaps, on some of these outcomes and precursor events.
Yes, trying to do a more open-ended sort of exploration, where you don't know what the outcome is that you're looking for, and you can actually see what all the outcomes are, and then sort of drill into those, and then decide if it's valuable for further exploration. Other areas, another area where we're seeing a lot of interest is trying to do the identification of bad actors within the access to the electronic medical record. So this grows out of the cybersecurity, a big cybersecurity practice which has come out of our work with the NSA and other government agencies, and we're bringing that over to healthcare. So another place, aside from the elementary things that you do are sort of penetration testing and best practices, but then what we're starting to do is trying to take a look at the security logs at the audit. So there's access logs every time somebody accesses an EMR, and we want to see if, if somebody is accessing an EMR in an anomalous fashion. Is that because they just made a mistake, or is there actually a pattern there of folks trying to violate privacy or trying to steal data?
Great.
In terms of all these, initiatives that you're looking at and describing, could you tell us a little bit about how you're visualizing this data and, and how you're relating those visualizations back to the business?
Yeah, so there are different tools that we use. I mean, on the big data side, there are a number of tools that we use, both open source and proprietary, for visualization of the data. In the for the more usual type of structured data visualization, we're utilizing a lot of the industry-leading tools, such as ClickView and Tableau, Business Objects, Spotfire, Cognos, MicroStrategy, etc.
Great. Let's move on to governance, which obviously has a huge role in healthcare, given both the volumes of data and the privacy issues and regulatory issues. Can you, David, walk us through some of the unique challenges healthcare has when it comes to data governance?
Right. Yes, and there are a lot of them. A lot of the challenges arise from the fact that the concepts, the clinical concepts and the business concepts, are sophisticated, and they are also diverse. So whereas, if you're dealing with if you're dealing with telecom, a cell phone is a cell phone, a minute of airtime is a minute of airtime. You can have a very common example is length of stay. You can have different definitions for length of stay. One is used by CMS for reimbursement. However, that really doesn't take into account folks that are in the hospital for long periods of time. There's a different definition of length of stay for that. Then there can be severity-weighted length of stay based on the severity of the diagnosis. And so trying to, and just multiply that times 1,000, and you have some of the challenges with data governance throughout the hospital. So in order to build out these analytics in a timely fashion so that they show value to the enterprise, it's very important to have a narrow scope, a constrained scope, where there's some number of KPIs, a reasonable number of KPIs, and a reasonable number of visualizations. So in my experience, it's usually 2 to 4 data sources and 200 to 300 data elements and 10 or 15 reports. And that's something that we can implement in a 4 to 6 month time frame and show value. And so it's very important that you have everybody agree on the outset that if we implement these KPIs and we're able to have people visualize them, that will be a good thing, and that will be valuable, and that will be worth the effort that we go through, because there's going to be a lot of pain in this area, because you're going to have people from different areas of the enterprise, sometimes within the hospital, sometimes hospitals and payers, sometimes inpatient ambulatory, folks that don't normally have to work together, who have to agree on these concepts, which may not show them immediate benefit. So we want to make that benefit not immediate, but reasonably attainable within the 4 to 6 month time frame. So that's where it really comes down to, that you have to have a governance process that's efficient and there is bought into at the highest level, and that there's some good way to resolve the inevitable conflicts that will occur, because if you don't, lots of times these initiatives can just sort of die from analysis paralysis. People end up not seeing the forest for the trees and having lengthy discussions about minute details for long periods of time, and then you don't get implemented in a timely fashion, and everybody gets mad and goes home. So that's, a good governance process is going to mitigate that.
Steve, any follow-up on the governance topic?
Yes, David. It sounds like obviously you need to do a lot of integration of these governance initiatives with your customers. Could you tell us a little bit about the key governance initiatives and challenges that you're seeing for your customers right now?
Yeah, so I mean, a lot of it has to do, the key to success with sort of any of these larger pieces of an analytics project, such as ETL, data modeling, governance, whatever, is that it really needs to be done within the context of a project that achieves value in a specific period of time. You'll probably hear me say that about 500 times, but that's really, what the challenge is. Because lots of times folks will say, all right, data governance is a good thing, and we need to implement data governance, or analytics is a good thing, we need to implement analytics, which is true, but it's hard, and it has to be in the context of a specific project. So it can't just be a standalone thing where you're just implementing governance on its own, but that you're implementing a project and there's governance along with it. And so that can make for some interesting challenges because, in most cases where we're doing analytics, it's not a greenfield. Folks have done some of these initiatives before, and you'll come in and they'll have a bunch of initiatives that have been implemented maybe without good governance, maybe that have the same metrics or KPIs or dimensions that you're trying to implement, or maybe they overlap. And you have to figure out how to reconcile that within the enterprise so that you can still go forward and implement, your data governance process and your analytics in a reproducible and usable fashion. Because that's the whole idea of having a good governance process, is that you don't have to rebuild everything completely when you go on to the next phase.
David, wrapping up, Steve and I are going to ask you just 2 more questions. I'll go first. Could you share with us your top 2 priorities for the coming year at Leidos Health?
Sure. My top 2 priorities are to continue to serve the clients that we already have and gain new ones. But aside from that, we're really looking to expand is into this what I call the first 2 pieces of an analytic project. So in our methodology, we've defined there are kind of 4 pieces to an analytics project, analogous to any sort of development project. There's initiation, or first there's prioritization, then there's initiation, then there's development, and then there's operationalization, productionalization. And a lot of the clients that we work with have some facility or capability around development and productionalization. And really where the most help is needed is in the which projects are most important, and then the initiation piece. In other words, how do we get this started? So what's the best tool to use for it, et cetera, et cetera. And that's where we're really seeing that we can add the most bang for the buck, because they may have they may have coders, they certainly have people that know how to run their production systems, but they don't necessarily have the expertise in those first 2 phases, which is really only gained from extensive experience. So when you've done this, 20 or 30 or 40 times, you learn how to do it. So that is one priority, is to expand the business in that area. And then the next priority is to try and expand in some of the areas for partnership that I mentioned. One was around text analytics and big data. Another area is the security, which I also mentioned earlier. And a third one is around trying to use the HL7 messaging, which is a messaging protocol used in hospitals to communicate among production systems, trying to use those messages to populate a clinical data repository, because that data already has a lot of the governance done on it already. I think that there's some value that can be obtained, because in other words, when you're communicating between the different systems, you already agreed on what a patient is and what a diagnosis is, what a location is, what a charge is. And so if we can leverage that, we can actually start to build the foundation for analytics with in a fast way and with less expense. So those are my top two priorities.
And David, just finally, across your customer base, do you see a couple of priorities that are sort of uniform across your entire customer base?
Yeah, I mean, everybody is moving towards population health, because that's the moving from pay for volume to pay for quality is basically moving from the management of individuals on a volume basis to the management of populations, basically keeping those populations as healthy as possible and having them go into the hospital as few times as possible, because that's one of the biggest expenditures. So that eventually, to do that right, is going to require that integration of claims and EMR data that I mentioned. But those are the steps that we see people taking. That, and I guess the other thing is also the focus on security, because of the the breaches that we've seen. There've been who knows how many this year, not just 10 or 20,000 people because somebody left a laptop in their car, but millions of people because people are actively hacking into the systems.
Right. And that'll have to be the last answer. Absolutely fascinating conversation. I'd like to thank David Silberstein of Leidos Health for joining us on this edition of ICCG's Close Up. If you'd like to watch other interviews, please visit iccg.org or roundworldsolutions.com. Thank you for watching. Until next time.
I'm Scott Cunningham, Senior Director, Solutions and Delivery for Round World Solutions, the experts in integrated governance with project execution. Our unique 360-degree view enables us to give CXOs a comprehensive view of where they are today, where they would like to be, and delivers a powerful change management structure to ensure they accomplish their goals. ICCG Close-Up is an interview panel where CXOs share their views on big data, governance, and their most pressing issues. At the conclusion of the interviews, we will be compiling the results into an industry and issue-specific report to share with all of the interviewees, emphasizing common interests and future plans associated with those interests across industries. The benefits to our participating CXOs are the creation of a virtual CXO interactive knowledge base, highly scaled shared resources, and the ability to learn from each other without having to reinvent the wheel. Thank you for watching ICCG's Close-Up, sponsored by Round World Solutions. For more information about our CXO interview panels or to join the conversation, please visit us at www.roundworldsolutions.com. Thank you.